everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. A pilot program that implements prior authorization for Medicare enrollees is raising concern among patients, but proponents of the program say it will cut down on unnecessary spending. Joining me today is Nick Hutt, a senior editor at the Healthcare Financial Management Association. Nick, the phrase prior authorization is bound to scare a few people who might be affected by this program because it can contribute to delays in care. Can you just give a brief refresher on what prior authorization is?
Sure. Prior authorization just means that before an insurer will agree to pay for a service, it needs to review that particular case to determine in its mind whether the specific service is necessary. And this could apply to private health insurers like United Healthcare, Blue Cross Blue Shield, and also to government insurers like Medicare and Medicaid.
So the centerpiece of this Medicare prior authorization program is AI, which is something else that tends to scare people right now. How exactly does this program work?
Sure. Well, this model goes by the acronym WISeR, which is a somewhat awkward acronym for Wasteful and Inappropriate Service Reduction. The goal of this model, as conceptualized by the Trump administration, is to reduce wasteful and low-value care by applying prior authorization to an expanded set of healthcare services for people who are covered by Medicare. Not a Medicare Advantage health plan, but Medicare Part B. This model does indeed apply AI and machine learning to that assessment, although human clinical review must be conducted before a healthcare service covered by Medicare can actually be denied. And incidentally, this model is scheduled to run for 6 years, beginning next year, 2026.
The focus here is pretty narrow. Abe Sutton, the director of the Center for Medicare and Medicaid Innovation, has said emergency care and hospital stays will not be included. What is being focused on in this program?
Indeed, if a patient needs emergency care or is admitted to a hospital for care, those services will not be subject to prior authorization. Only elective and outpatient services will be, at least at the outset. They're targeting healthcare items and services that are considered particularly vulnerable to wasteful utilization. There's about 10 broad categories that are included. A few of them, as examples, are skin and tissue substitutes for wound care, epidural steroid injection for pain management, and an array of nerve stimulation services.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.